And action.
Hi, I'm McKenna. I am going to be demonstrating how to do a central line dressing change today. So the first thing you're going to want to do is you want to check the order to make sure that you are indeed supposed to change the dressing. You don't want to change it too frequent, and you want to make sure you have an order. Then you're going to make sure you're doing it on the right patient and make sure they have no allergies to any of the cleaning solutions you're going to use, such as alcohol, the CHG stuff. And yeah, so then we're gonna go see the patient. So knock knock. Hi Bob, my name's McKenna. How are you today? Bob is good. I'm gonna maintain privacy. I'm a student nurse and I'm going to be doing your dressing change here on your central line. Does that sound okay? He says that's great and he understands why we need to do that. And so what I'm gonna do is I'm going to wash my hands, not throw it on the ground. I am then going to put a pair of gloves on. Bob, can you give me your full name and date of birth? Checking the armband. He says Bob Owens, 4497, and that matches. And I asked him if he has any allergies. He says he does not have any allergies to anything, so that is good. I'm gonna get this over here by me. I'm just gonna inspect around the insertion site, assessing for redness, edema, ecchymosis, see if there's any drainage that I can see, and approximation. I'm gonna palpate gently for any tenderness. He says it is not tender whatsoever. So I'm going to measure. And you're gonna wanna measure about 6 inches above the site of insertion, so approximately right there. We're going to put this bad boy around. And it looks like we got about 9 3/4. And that matches what I had in the chart from the previous measurement. And we're gonna measure from the site of insertion to the end of the hub. So about 4 1/4. So that is good as well. Anything of over half an inch could be a sign of infiltration or other problems, so we just want to make sure we're always measuring that and keeping an eye on it. So now I'm going to take my gloves off, wash my hands. I am going to put my mask on. Wash my hands. And then I'm going to explain to Bob that he needs to wear a mask as well to prevent the spread of infection or germs. He's not coughing on there. And he understands why he has to. And if they can't wear a mask, just have them look away from the site. So I'm going to wash my hands again. I'm going to prepare my sterile field. No, I'm not. I'm going to put another pair of gloves on. And I'm going to take that old dressing off before we do all that fun stuff. And when you take this dressing off, you want to make sure you're pulling to the site of insertion so you aren't risking pulling that out. And I'm going to assess this for any drainage, blood. There's not. It looks good. I'm going to throw that away in my pretend garbage. Take my gloves off. Wash my hands again. Now I'm going to prepare my field. Opening the sterile package away from me. And I'm going to put my gloves on. Alright, so I got those on and we're good. So now what I'm going to do is I'm going to take my alcohol swabs and I'm just going to clean around the site of insertion, getting rid of any blood in a circular motion. Now what I'm going to do is I'm going to take my CHG, open that up, and I'm going to scrub with quite a bit of friction, 2 to 3 inches around the total site for 30 seconds or however long your facility calls for. Alright, we'll say that's been 30 seconds. We're going to let that dry. We're then going to take a SurePrep and we're going to wipe around. And next thing we're going to do is wait for that to dry. Then we're going to take our sterile dressing using the no-touch method. I'm going to peel the back off of this. Get rid of it. No touch. And in a clinical setting, you would not have to worry about the line and hub moving. So I'm just going to move that for right now because they are sutured in typically. So you don't have to worry about that because it would stay in place. It's still very well approximated. I didn't goof anything up. Okay. I'm going to peel this off. Make sure that's on there. And we're going to take the extra piece of tape that's on there. And we're going to label that with the date, time, my initials, so the next person that comes in knows the last time it was changed. And then I'm going to take my sterile gloves off. Wash my hands. Take my mask off. Wash my hands. Take my patient's mask off. Wash my hands. I'm going to ask Bob how he's feeling. He says he feels great. I told him there was no complications with the dressing change. I would make sure he is safe. Bed's at the lowest position. Side rails are up. Call lights within reach. Then I would go document. And I would document any of my assessment findings like the Rita and COCA. I would date, time, and how the patient handled it. Lifetime considerations, I would, if it was a younger child, have a guardian in the room reassuring him, maybe give him a transparent film dressing to look at to see what was going to be placed on the arm. And that's that. So I would wash my hands before leaving the room and go document.